So when a heavy snorer with apneas arrives to my attention, I think firstly, I have to examine the patient, to ask him many questions, to perform the Epworth Sleepiness Scale score in order to see how heavy is the situation. And of course, I will make an ENT visit. So an ENT visit is necessary, not only to see the oropharynx opening his mouth, but performing a Müller test in order to check where is the closure of his throat, where the total obstruction that leads to apneas occurs. That is very important for the planning of the treatment. What is also absolutely important is to have a sleep study. So both things, ENT visit and sleep study, will be the factors that will determine my choice in choosing which is the right treatment for him. Of course, if the patient has moderate to severe apnea, which means an apnea-hypopnea index score up to 15, so more than 15, I will have to tell the patient to wear a CPAP, which is the annoying machine that unfortunately patients can't bear for a long time. But I will have to tell him, of course, in order not to risk a heart infarction, a stroke, for him to become a bit dysmetabolic and have his life ruined. So first I will have to tell him to wear a CPAP. Then I will, of course, I always tell my patients, first we put it and then we'll try the way to remove it. Remove it in which way? Firstly, with a good counseling of lifestyle. Of course, having a light dinner, of course, eating less, so losing weight. That is so important, to lose weight when they are overweight, and most of our patients are obese or overweight. So lose weight, a right counseling, trying to avoid reflux, no non-alcoholic drinks, drinks with no gas. So plain water, not drinking before going to bed, avoiding yogurt, rice, heavy dinner. And of course now I'm speaking only of some aspects, but it is a very long description. So not so many coffees, not so many teas, of course, we all know that. Then we can perform laser in cases we will choose the right treatment analyzing the Müller test. So if the obstruction is at the soft palate, we will have to treat patients with laser. This is an option. This is a non-invasive option. Of course, we have to speak to patient and tell him that he also can choose surgery. But unfortunately, surgery is not long-lasting. Unfortunately, surgery has many side effects, and unfortunately, surgery is not successful in 100% of cases. When it goes well, it can be successful in 80% of cases, but when it's often it's very lower result. So why begin with an invasive treatment? Why begin with a treatment that will not be long-lasting? In my opinion, it's much better to begin from non-invasive treatments, and of course to check after laser with a new sleep study the result. If the result is not adequate, of course, then we can increase invasivity. But it's for myself or for my husband, I would never love something invasive. First, we begin with non-invasive treatments that have no risk for the patient, no side effects. So first we could begin with laser when the soft palate is obstructive. Laser treatments are not painful. They have no side effects. They don't require a local anesthesiology, local anesthetic. They don't require any painkiller post-treatment. They don't take any painkillers after the treatment. So it's fantastic as it works. We need at least 4 treatments, and then after each treatment, patient can be reanalyzed. We can ask him how he sleeps. We can ask him his quality of rest. We can ask him if his wife noticed apneas or not, if he dreams more, if his mouth is less dry, many questionnaires we can ask him. At the end of the treatments, it is absolutely necessary to perform this sleep study after 2 months of the end of the treatments, and then we will see if another kind of treatment is necessary or not. In the other case, when his base of tongue is obstructing, I think we first will have to start from an oral appliance. Or if the patient wants, of course we can do surgery on the base of tongue, but it's a heavy surgery, really heavy surgery. There is robotic surgery that is fantastic, that can be performed, but of course the degree of invasivity is so high. So if the patient is compliant, if he has no temporomandibular joint diseases, he can wear an oral appliance. In this European dental clinic, it's fantastic because they can do both oral appliance and laser treatments. So this could be a fantastic choice. Also, some patients have base of tongue fall and also, unfortunately, palatal obstruction. So we have to decide on each case. Of course, each case is different. The only important thing is after each step that we do is to confirm the good results. So only when we have a normalized sleep study we can tell the patient that he can remove his hip up. It's a challenge also for the patient, not only for us but also for him. So I'm still working in the University of Genova. I'm a professor there. I'm leading many courses and I'm continuously studying in order to go on with all this discipline in trying the best way to cure patients. So studies are going on, and I'm very grateful to be in Jordan and to be able to speak about that with you. I found beautiful doctors that are incredibly going on with their brains, with their minds, in finding the best way to treat patients, and that was really a great experience for me. Thank you so much.